patient is a 27-year-old prime. She was scheduled for an induction at 41 weeks. She has no medical history. She's very straightforward. So we go ahead and admit her. And then we start her induction. So we place a cook balloon, we give her Pitocin, we later on AROM her, and she achieved 7 centimeters dilated, and she was doing really well initially. And then we noted that she had prolonged decels, and we were investigating, and then we discovered a cord prolapse. So we go ahead and we bring her back to the OR for an emergency C-section, and the baby delivers and does well. But I noted that after delivery, the uterus was very atonic. So we go ahead and we close the hysterotomy, and then we massage, and we gave uterotonics. We just gave all of them. So we gave the Methergin, the Hemobane, and the Cytotec because it was just so atonic. And we massaged some more, and it was just still very atonic. So I decided to use the Jada at that point. So I did this case with a resident. So I fortunately had another resident who was available and went under the drapes to clear out her blood and clots, and then placed the Jada in. So the Jada was placed in the OR just right after we closed the hysterotomy. And I'm holding the uterus in my hand, and just very quickly, I can feel the uterus just clamp down on itself. So we're very satisfied. So one thing is that we didn't have the portable suction available in the OR at that time. So what we did was we hooked it up to the Neptune suction and placed it at 80 millimeters of mercury. And so the Neptune worked very well for us. And then we go ahead and we close the uterus because her tone is excellent. So as we're closing the uterus, we do need to eventually move her to the recovery room. So the team is obtaining the portable suction. So we go ahead and we finish the case, we close her up, and then we switch the vacuum device from the Neptune in the OR to the portable suction so that we can roll her to the recovery room. So now she's in the recovery room, and so she should be on active suction. So at this time, during this hour that she is to be on active suction, a minimum of 1 hour, we go and we assess her. And so as I walk in, the first thing I do is I look at the canister, which has no blood. Wonderful. The second thing I do is I assess the tone, the uterine tone. And when I did that, I noticed that the tone just wasn't what it was. It just was not as firm as what it was. And then I also noticed that there was a little bit of blood on her chucks. And as I'm just checking her tone, I can see a little bit more blood come out. So now I need to troubleshoot, what's going on. So the first thing I did was I looked at our vacuum device. So on the left here is our portable suction. And then on the right is our wall suction, a picture of our wall suction. So when I looked at our portable suction, which is what the patient is currently connected to, I see that the needle is just sadly quivering between 0 and 50. So she wasn't on effective suction. And then the second thing that I noticed is that this gauge is the pressure gauge ranges from 0 to 760. So the pressure that we want is 80. And that is just this little pie, this little slither in this gauge. Whereas if we compare that to our normal wall suction that, most of us are used to, the range is from 0 to 200. And 80 is just seems much so the wall suction just seems like a more appropriate device for us. So at this point, I know that we don't have adequate suction. So that's one problem is the portable suction or the suction, right? The second problem that I have is that, so I noticed that she's bleeding, right? Around the Jada. So I'm thinking that she probably has, and the tone isn't that great. So I'm thinking that, while she was not on suction, the uterus just became atonic again and collected blood. So I decided that I'm just going to start over. So I broke the suction, I deflated the cervical seal, and then I just pulled out the Jada. So the Jada is a single use device, but at the same time, it's a single patient use device. So you can use the same Jada on the same patient. So my intention was to reuse the same Jada on this patient. So I had my nurse put a chuck right next to her. And right after I pulled out the Jada, I had my nurse just like hold it in midair, just like over the chucks. Okay. And so then I went to evacuate her uterus. So I ended up evacuating a little more than 1,200 cc's. So after the uterus is completely empty, I start the normal process that I would do to insert the Jada. So with an empty uterus now, I insert the Jada, and then I go ahead and inflate the cervical seal and place the vacuum very quickly. And, again, within minutes, the tone is excellent and the bleeding is under control. Excuse me. And she continued to do well with excellent tone and controlled bleeding throughout the time that it was on active vacuum. And I decided to keep her on active suction for 2 hours. And then after the 2 hours, I disconnected the suction and deflated the tube for the verification phase. And she continued to do well. So we pulled out the Jada. So after replacement, the Jada was in for a total of 2.5 hours. And so at this point, her blood loss is a little more than 2,000. And I also noted that my patient was pale and her heart rate was high in the 120s to 130s, and her blood pressures were in the 60s to 40s. So I decided to transfuse her a unit while it was on active suction. So in summary, this was a scheduled induction where her labor course was complicated by cord prolapse. So she had an emergency C-section, which was noted and intra-op, we noted the ATME. So the Jada was placed very soon after, and it was initially working very well when we had good suction with the Neptune. But after we transferred her to the portable suction did not have adequate suction. So this allowed the uterus to become atonic again and collect blood. And so we just started over, and from there, the patient did well. So she goes on to postpartum, and her on post-op day 1, her hemoglobin was 7.1, and she was symptomatic with like dizziness and weakness. So we transfused her another unit, and then on post-op day 2, her hemoglobin was 8.1. So she overall did well, and she was eventually discharged on post-op day 4.